Good morning. I am Dr. Jess Trimble. It is Wednesday, June 24th. I guess it is now. Oh my goodness, it's almost July. I am here today because Kelly couldn't make it. And so we're going to have a fun day of talking just telehealth tips and news. And we have some interesting ones today. We'll go ahead and start with our telehealth tip of the day. And this is something that I am really quite passionate about, which is how can we do something amazing with just our free stuff, right? Telehealth platforms are wonderful, don't get me wrong. They have all of the bells and whistles and integrations that you need. But for a lot of clinics, it's just not the right time to do it. There's a lot of platforms to choose from. You need to spend some time going through them. So what can you do in the meantime until you choose your platform? Or what can you do to augment your platform if it doesn't have all of the bells and whistles that you want? And in those cases, I'm going to say for the tip of the day, use Google. Google Suite has such amazing free tools. And when I helped to start Fuzzy Pet Health, which provided mobile veterinary care and telemedicine together, we started with Google. And this was really, our first few patients. We did everything out of Google Sheets, Google Forms, and Gmail. And so I wanted to give you just sort of a brief little workflow of how these things worked for us and how they're working for other vets right now, so that you can figure out how to use these without spending a dime and making yourself much more efficient. So web forms, I think, are one of the best parts of Google because these web forms you can put into an email and it will kick out the responses into an Excel sheet. So for instance, say at the beginning of the day or the day before, you email all of your clients to remind them that they have an appointment the next day. In that email, you can have a link to a Google form that says, please fill out this form before you come to your appointment. Within that form can be all the standard stuff, is your name right, your address right, blah, blah, blah. But it can also have, what experience or what symptoms is your pet experiencing, what medications are they on? And these can all kick out into this nice, neat little Excel sheet, essentially a Google form, that then your technician or yourself can just copy and paste those into the medical record, and you'll have just a nice, succinct, beautiful, and organized summary for every single patient just in your regular Google Drive. So we use these very heavily to get new client information, to get pet histories, but what we also do is really figuring out how to integrate those into an email. And so say you have your clinic telehealth email, abcclinictelehealth@gmail.com. You can, for free and very easily, integrate in a calendar invitation so that say you wanted to offer them a telehealth visit, they can just click on that calendar, find a free spot to schedule. And then within that calendar invite is a Google Hangout link that you and your client can then speak through. And so Google is going to do a lot of this for you. It will automatically put that Hangout link in there for you. It will automatically kick this information from a Google form into the spreadsheet. So don't be intimidated by all the little bits and pieces, because I know there are a lot. Just know that Google can really make your life a lot easier. And Hangouts now has really spent a little bit of time making itself better for telehealth specifically. And so there's some fun new, features that Hangouts has been doing to help really just for telehealth visits. So if you're struggling with getting telehealth started in your clinic, this would be a great way to start, is just doing histories via a web form that you can send to your clients the day before or the morning of, or even when they pull up into your parking lot and they're sitting there curbside waiting for their appointment. You can ask them to go to the website and fill out that form while they wait. Save you and your clients a ton of time. And again, integrating in things like Hangouts, Google Calendar, even Google Drive, so that they can drop in medical records, giving them access to their pet's Google Drive folder so that they can add things in, will make everyone's life easier. So don't be afraid to use it. It's a great tool. And next we'll pop on over to the news of the day. This one is interesting because it really takes a look at our future of telehealth and telemedicine in this country. So prior to COVID, telehealth, telemedicine was being used, but it wasn't really being utilized to its fullest possible use. And a lot of that was partially because of us, the doctors, using it, because some of us don't think that we can do as good of a job via telehealth as we can in person, which in many cases is very true. Our patients need a hands-on exam, but in some cases it can be super beneficial, as we've talked about in all these past weeks. And so when the government sort of put out these rules to help make telehealth and telemedicine more accessible for people during this pandemic, it opened up a lot of routes for state governors to make their own rules around this, as many of them did. They created these emergency declarations, and many of them allowed doctors from neighboring states to be able to practice telemedicine in their own state as long as they were licensed. But it also opened up the ability to use non-HIPAA compliant platforms like Google Hangouts in place of these more expensive platforms. And so now human medical doctors are able to use things like FaceTime and Google Hangouts and Skype so that they can reach more patients. Because we know that the patients that need telehealth the most are often the patients that can't access it, right? They live in very rural areas, they're elderly. These are the people that don't have great internet and aren't really digitally native enough to understand how to use it. So these rules becoming permanent is really going to help the populations that need this the most. Now, granted, this is a news article on the human side, Idaho making telehealth expansion permanent. But a lot of these rules will roll over to veterinary medicine. And a lot of these rules are general enough that they're just saying any doctors or any healthcare providers. And so there will be some of these declarations made permanent that will really affect us as veterinarians. So I'm encouraging you to really pay attention to your governor's declarations as what they are now, because if you think they're not going to stick around, you might be surprised. There is a large group of lobbyists right now from the American Telehealth Association and other bigger groups that use a lot of telehealth, like Medicare and Kaiser and some of the veterans groups that really, really want telehealth and these emergency declarations to become a permanent fixture. And interestingly enough, I believe Medicare specifically, this time last year, they did about 3,000 telehealth sessions. This year, in the same amount of time, they did 117,000 sessions. So if that doesn't show just how much more access telehealth is providing, I don't know what will. And those kind of numbers are what is going to really make these rules permanent. They will become law. And so if you are still of the opinion that this is temporary, change your mind. These things are sticking around. It might take, 6 months to a year, but I truly do believe with these declarations becoming permanent, this will strongly affect veterinary hospitals. And so you should be thinking of all that you're doing in the telehealth world right now. This is going to be long-term. It's not going anywhere. So from the news of the day, I also wanted to pass on, we always talk about our marketing to self and what things we're doing to sort of help ourselves, stay happy or fulfill ourselves, fill our balloons. And we talk a lot about gardening. We talk a lot about hiking. Something that I've been doing a lot of this summer is giving away my advice for free. Funny story is I'd actually taken this year off from work to plan to take the spring and summer to travel. I'm actually supposed to be in Thailand teaching right now, but here I am instead. And so what I'm really trying to do this summer is, because I am not working at the moment, I am trying to help my colleagues as much as possible. I am trying to give away my advice and expertise to as many people as I can to help change their lives for the positive. And I had this wonderful conversation on Monday morning with a local veterinarian who was exhausted doing clinical work, and she was interested in getting into industry or non-clinical work. And so we sat and chatted, and that filled me up so much that I was able to help her understand that there were paths out of the hole that she's in right now. And then after that, I was able to have a conversation with a veterinarian who's starting to develop a curriculum for a veterinary school, and they want to teach how to provide telehealth properly. And so we talked for a long time, and we soapboxed for a long time about how to do this right for students. And again, filled me up knowing that my expertise can help the next generation of veterinarians be happier and more efficient and more successful. So I know a lot of you are a lot busier than I am right now, but if you've got the time, just reach out to your colleagues and provide that advice and expertise. It's going to help them a ton, but it will also help you, or at least it helps me really feel a little bit more fulfilled that I'm not just helping myself, I'm helping my entire profession, and thus helping far more people, far more pets, far more students than I would be able to otherwise. So it's, just that message of love each other and help each other and reach out. And I know imposter syndrome is real for a lot of us. And I find that providing my advice helps take that away too. Being able to help people with what I've learned is one of the best things that I can do to help keep my sanity. So that's all we've got for this Wednesday. Thank you for joining us. I will be here next Wednesday again to talk more telehealth. And I hope that everybody has a great rest of your week, and Kelly should be back soon. Bye.